I want to thank TA Sciences for their support for this non-CME program. And the booths, I believe, don't open until this afternoon, but the folks from TA Sciences will be outside at the end of this presentation if you have any questions or you want to get information about obtaining the TA-65. There also are presentations about telomeres tomorrow during the regular CME program. Thank you. So we're going to talk about telomeres, telomerase. We'll look a little bit at the human epidemiology. We'll look at some of the animal models. I don't condone animal research, but nonetheless others do it, and it is actually quite fascinating. We'll look at some of the human studies, in particular with TA-65 itself, and we'll talk about a few of case studies we have at our institute, talk about some conclusions, and we'll have time for Q&A, and I'll remain afterwards, and I'm going to be around for the duration of the conference. According to Greek mythology, the goddess Eos asked Zeus to grant immortality to the Trojan Tithonus, her mortal lover. But Eos had forgotten to ask for eternal youth, so Tithonus received the gift of immortality and continued to age, withering beyond recognition and begging eternally for death. Sounds like it could be some of our patients. So a problem had been noted for a number of decades that when DNA was replicated, there was a so-called end replication problem in that, I'm sorry, let's see, most of you are on this side, so I can use the pointer here. Does that show? I don't see it. Anyway, you can see down towards the bottom, the DNA polymerase is unable to put in the last bit of DNA replication. And so therefore, every time cells divide, a little piece of the DNA will be lost, and that is why telomeres get shorter. It's just an aberration in how nature made us and made mammals. At the same time, we're familiar with the Hayflick limit, that if you put cells in vitro, they only will reproduce and will divide up to 50 doublings, and then they just stop doubling. And that is the so-called Hayflick limit, and the reason that happens, as it turns out, is telomere shortening. So over 35 years of research led to the Nobel Prize in Physiology or Medicine in 2009 for the discovery of how chromosomes are protected by telomeres and the enzyme telomerase. You can see there on the left Professor Elizabeth Blackburn at UCSF, my alma mater, Dr. Carol Greider from Hopkins, and Dr. Jack Sostak from Harvard. Telomeres shorten with aging, as shown here. The telomeres at the end of the... Can you see this at all? I don't see it. No? Okay. Well, you can see that over time, if we start with one daughter cell that divides into two daughter cells, the telomeres get a little bit shorter at each end, and then those two daughter cells further divide, leading to further shortening, and those daughter cells further divide, leading to more shortening, and eventually cell division stops. Okay. All right. Thank you. And pardon my naivete. Oh, there we are. Okay. Better? No? I still don't see it. Okay. Sorry, Shane. Appreciate your help. So the telomeres will divide and will get shorter, and you can see on the middle there, they get short enough, you get loss of function, DNA damage proteins are elicited, you get a DNA damage response that will lead to either apoptosis or programmed cell death, or senescence, which is a phenotype that's implied by the term where the cell just basically cannot work anymore in doing its function. On the right there, telomeres therefore protect DNA. They prevent DNA erosion, recombination, and fusion, which of course markedly increases the risk of cancers. And we're learning there are many other functions, including that the telomeres maintain mitochondria. So we like to think of the telomere as the aglet cap of a shoestring. You can see off to the right where there's no aglet left, and off to the left where we have perfect aglet intact. How important are telomeres? This is Professor Elizabeth Blackburn, Nobel laureate, 2009. Quote, "Telomere shortness is associated with just about all the major diseases of aging, from cardiovascular disease, death from cardiovascular disease, risks of cardiovascular disease, diabetes risks such as insulin resistance, vascular dementia, to arthritis." The list goes on, and the correlation is always in the same direction. Shorter telomere length is associated with more disease. The association is absolutely solid now because it has been found in so many cohorts that it cannot be a statistical accident. Professor Rodrigo Collado, then at the National Institutes of Health, published in the New England Journal of Medicine in an article titled "Telomere Diseases," quote, "Telomere dysfunction seems to underlie the development of a range of human genetic, degenerative, aging diseases, and cancer." The number of abstracts in this research area continues to mushroom. Just this last month, if you enter telomere or telomerase onto PubMed, you get 22,000. If you enter in menopause, you only get 52,000, which has been around obviously a lot longer than our information about telomeres. So this is our San Francisco metrosexual who is shaving his legs but not his chest. And if we zoom in on his skin cells, this is thanks to Dr. Bill Andrews, we can see the nucleus that is filled with 23 pairs of chromosomes, and at the end of each chromosome, the Greek telos, which means end, and meros refers to part. So the telomere structure, if you focus on the red arrow, is a cell which then contains the chromosomes, and if you unravel all the chromosomes at the very, very end, there's a single strand of DNA that's always in the sequence TTAGGG in humans. And if you look at how this single strand of DNA appears, it comes back on itself in a so-called T-loop, and is composed of these so-called shelterin complexes that are composed of other proteins. And there can be mutations in any of the DNA that makes these proteins or abnormalities of proteins that's going to lead to telomere dysfunction. On a typical graph of telomere shortening with age, whether these are prevalence studies or prospective studies, you can see always on the left we have telomere length, which is going to be in kilobases from 0 all the way up to here's 12 kilobases, and on the x-axis is age, birth, age 20, 40, 60, 80, 100. And at conception, we have about 15 kilobase pairs. At birth, we have about 10 kilobase pairs. And over our lifespan, we lose 5 to 7 kilobases. At senescence or apoptosis, we're at roughly 3 to 5 kilobases. And on average, humans lose 0.015 up to 0.06 kilobases per year just by living and having cells reproduce. More recent studies suggest it's closer to the upper end there. So with time, after birth, age 20, age 40, age 60, the telomeres shorten and cells cannot work well. There are several different types of commercial labs that make telomere tests that can be used. These are not yet FDA approved. SpectraCell makes a qPCR as shown here, life length, and telomere diagnostics and repeat diagnostics uses the fluorescence in situ hybridization or a variation of that. The first, second, and fourth here are blood tests. And telomere diagnostics uses saliva. This is also available through TA Sciences, and I'm sure the representatives can give more information about that. So this is a sample test report we have from one of our patients, woman, 44 years old. This is the SpectraCell test, qPCR, and you can see that the mean telomere score is reported, and then her number is 7.85 kilobases. She's 44 years old. And so that's where her test result comes up, and they give a percentile at 66th percentile. So she's doing better than women in her age range. About 6 months later, we did the life length telomere test on her. Now again, the life length measures median telomere, whereas the SpectraCell measures mean. So you can't really compare median and mean. They're two different arithmetic numbers, but they're both useful. And their report, here you can see the telomere length on the y-axis, chronologic age, and then her number is 6.6 kilobases, which was at the 47th percentile, and they have it reported in these bands of percentiles that are shown here. The life length test also reports the percent short telomeres. An average telomere length is going to be composed of some that are long and some that are shorter. And there's more information emerging in the medical literature that the short telomeres are the real Achilles heel, and the percent short telomeres is going to be a significant factor to look at. So this is an article by Dr. Greider, one of our Nobel laureates. Quote, "The shortest telomere, not average telomere length, is critical for cell viability and chromosome stability." Dr. Maria Blasco, who's been very involved in this research and is head of the lab at Life Length, published an article entitled, "The Rate of Increase of Short Telomeres Predicts Shorter Longevity in Mice." And it's more than likely going to be the same in humans as well. So for our same patient, age 44, we get here 16% short telomeres, which puts her at the 38th percentile. Now, on an unfavorable marker, a lower percentile is more desirable. And on a marker like the telomere length, of course, longer is going to be better, at least up to a point. So 38th percentile, not bad. She's doing better than most women in her age range. And then life length does give an estimated biologic age that uses the percent short telomeres and the median telomere length. So telomere loss over time is related to telomerase loss. So telomerase, the enzyme that extends the telomeres, is not turned on in most cells. In most somatic cells, telomerase is turned off at birth. Therefore, there's no mechanism for allowing the telomeres to extend again. But telomerase is maintained in so-called germ cells, although it's specifically sperm and not eggs. There's even some evidence that telomerase even increases in sperm cells, so that the telomeres in sperm will actually increase with aging slightly. We'll come to that. Most somatic cells, they just get shorter and shorter with aging. And there are a few premature aging syndromes, which we'll look at as well. When certain mutations occur in telomere function, that can be a risk factor for cancers that can come up in later life. Telomeres shorten in all the cell compartments, including those that rapid turnover in humans. This is leukocytes and skin. And in slower turnover compartments like muscle and fat. And you can see a typical pattern with aging. Telomeres get shorter, whether they're men or women. And a very important concept, if the telomeres get shorter in all the cellular compartments, that's going to include the immune system. The immune system, of course, has to fight off infections and fight off cancers. Well, if the immune system can't do its normal job, that's going to render us susceptible to more infections with aging and make us more susceptible to cancers that cannot be eradicated. So germ cell lines maintain their telomeres, hematopoietic stem cells, telomeres get shorter and shorter, myeloid and lymphocyte, telomere length gets shorter with aging as well. Telomerase is a natural enzyme that helps to extend telomeres, discovered in 1985. When telomerase is activated, it adds DNA bases at the ends of the chromosomes, allows cells to live longer and revert to a more youthful phenotype. Telomerase preferentially extends short telomeres, and it's active throughout embryogenesis. Excuse me. This is a bubble cartoon of what telomerase looks like. The main components are TERT, telomerase reverse transcriptase, shown here, as well as TERK, telomerase RNA component shown here, and there are various other proteins that are involved. Mutations in any of these will lead to telomere dysfunction. And in a slide from Professor Woody Wright, telomerase will add on base pairs to extend the telomeres in the typical TTAGGG distribution in humans. So telomerase can extend the telomeres. Let's look at some of the human studies. One of the first that came out was Professor Richard Cawthon at University of Utah. Small study, 143 people, age greater than 60 years, followed for 15 years, and shorter telomeres meant shorter survival, including a 2-fold higher mortality due to all causes, 3-fold higher mortality from heart disease, 8-fold higher mortality from infectious disease, and over a 1.5-fold higher risk for each of stroke and cancer. So if you were in the upper half of telomere length, you lived longer. Here you can see proportions surviving out to 15 years. Half survived, whereas if you're in the lower half of telomere length, only 35% survived. And there was no significant difference when other cofactors for telomere shortening were considered. Trying to filter out genetic factors for telomere shortening. This is the Swedish twin study, 175 Swedish twin pairs. An older crowd here, mean of 79 years, followed for 7 years. The co-twin with the shorter telomeres had a 2.8 times greater risk of death than their co-twin with the longer telomere measurement. So here's out to roughly 10 years. This is showing you the quartiles. The quartile with the longest telomere, about 70% survival, whereas those in the shortest quartile, only 25% survived. Larger study, this is a UCSF prospective heart and soul study, 780 patients, mostly men, followed up for 5 years. Patients with shorter telomeres had twice the risk of cardiac death as those with longer telomeres when adjusted for all other known factors for premature mortality. And this is the Kaplan-Meier survivor graph there, and you can see that the highest quartile, 90% survival rate, the lowest quartile, approximately 70% survival rate. Cancer. Shorter telomeres markedly increases the risk of cancers. This is a 15-year prospective study of 1,000 persons from Brunec, Italy, mean age 63 years. This is the incidence of cancer. You can see here after 15 years, 3-fold increased risk of cancer in the shortest tertile compared to the longest tertile, and cancer mortality, a 10-fold increased risk of death comparing those in the shortest tertile to those in the longest tertile. A large meta-analysis of cancer risk, 11,000 patients with 13,000 controls from 21 different publications. This is the odds ratio bar, and there was 1.35 odds of increased risk of cancer when followed over time in these studies. Other factors affect telomere length. One of them is stress. Here's caretakers of Alzheimer's patients, small study, but caretakers had significantly shorter telomeres than control patients that were age-matched, gender-matched, not taking care of spouses with Alzheimer's. And you can see the length was 6.2 in the caretaker taking care of the Alzheimer's patients versus 6.4 kilobases if they weren't. Quote, these findings demonstrate that chronic stress is associated with altered T-cell function and accelerated immune aging as suggested by excessive telomere loss, approximately 4 to 8 years of shortened lifetime. So we're all familiar with the difficulty of Alzheimer's disease and a primary caretaker. Exercise in many studies is associated with longer telomeres, and a lack is associated with shorter telomeres. This is the heart and soul study again in measuring METs. This is metabolic equivalent tasks. It's basically a measure of fitness, and the greater the fitness, as shown on the x-axis here, the longer the telomeres. And looking at the proportion with telomere length in the lowest quartile by exercise capacity, those that had much less exercise capacity with lower METs had much higher rate of short telomeres compared to those who were the most fit. Diabesity, study after study after study, will show a clear risk for developing diabetes, having worsened diabetes, for developing obesity, or for having further telomere shortening with obesity. Longer telomeres are associated with having an older father and even an older grandfather. How can that be? Said before that people get older and their telomeres get shorter and shorter and shorter. But I also said in the sperm compartment, telomerase is maintained and sperm length actually will increase a little bit, and therefore older fathers contribute to longer telomeres in their offspring. So here, shown on the father's age here, is this not? If your father is 27 years or older at the time of conception, and your grandfather here is 30 years or older at the time of conception, then the offspring has 10% longer telomeres than if the father is younger or the grandfather is younger. It's actually calculated per year of increasing paternal age at conception. There's an increase in 0.017 kilobase pairs in the offspring. So if you can possibly choose your father, you want him to be older. Some of the premature aging syndromes, one of them is called dyskeratosis congenita, clearly shows premature aging due to mutations in TERK, and they get telomere shortening. They have increased cancer risk, infections, early hair loss and graying, early osteoporosis, pulmonary fibrosis, and they die younger. Dyskeratosis congenita, you can see the typical nail dysplasia, as shown here on the top, by age 10, and leukoplakia inside the mouth, is shown here and on the tongue. And they also have this typical reticular pattern on the skin, and even these leukoplakic spots on the skin. Turns out idiopathic pulmonary fibrosis is not so idiopathic. It's due to telomere shortening, due to mutations in TERK or TERT. So here you can see a typical CT scan. Once it's diagnosed, survival is about 3 years. Aplastic anemia, here you can see bone marrow, completely acellular on the left, yet having the normal cellular elements on the right. And so far, a third of patients with acquired aplastic anemia is due to short telomeres with mutations in TERT or TERK. So something you all prescribe or are going to learn to prescribe will help lengthen telomeres in patients with aplastic anemia. What might that treatment be? How do you treat aplastic anemia? In men, testosterone. Now I'm going to show you the hormones in general will increase telomerase and will lengthen telomeres. So in summary of this part, if we consider dyskeratosis congenita, aplastic anemia, and idiopathic pulmonary fibrosis, the mean telomere lengths in these are always at the very, very low end or even below the first percentile. And on this balloon cartoon that summarizes issues related to genotype and phenotype of spectrum of telomere disorders, here you can see dyskeratosis congenita associated with shorter telomere lengths, aplastic anemia, pulmonary fibrosis, and including aging that we can add on to here as well. So shorter telomeres, I keep adding on to this list and it gets longer and longer, but just for completeness I put everything on there. I may skip over terms that I've already discussed. Earlier death is associated with shorter telomeres. Older age is associated. Male gender, except the Amish, of course they don't drink alcohol and they don't smoke cigarettes, which of course is going to be a cofactor for shorter telomeres. Caucasian race, shorter than African American. Father with premature heart attack, you are more likely to have shorter telomeres. Certain genetic polymorphisms. Stressors, including environmental, physiological, and psychological, are associated with shorter telomeres, including post-traumatic stress disorder patients compared to controls. And the stress more or less is due to high cortisol. There are other stress hormones involved that are probably cofactors here. For women, employment and work schedule, if it's too much, shorter telomeres. Childhood institution or trauma, those kids will have shorter telomeres than controls who did not have trauma or childhood institution. Depression in most studies, pessimism amongst women, phobic anxiety amongst women, hostility in men. Doesn't mean that the opposite gender doesn't have those, it just means it wasn't measured in that study. Poor sleep quality in women, less sleep in women and men, and sleep apnea will shorten the telomeres markedly. Migraine in women, less education, low physical activity, smoking cigarettes, alcohol consumption, polycyclic aromatic hydrocarbon exposure, lead in vitro. Cardiovascular disease, it really goes very complete here, whether it's hypertension, myocardial infarction, congestive heart failure, atherosclerosis, abdominal aortic aneurysm, carotid artery disease, or stroke in general are associated and can predict shorter telomeres. We've talked about diabetes, obesity, and cancers, osteoporosis in most studies, avascular necrosis, osteoarthritis, rheumatoid arthritis in most studies, hepatic cirrhosis and progression, inflammatory bowel disease, COPD. The neurodegenerative diseases are a little less clear, but in general the trend is going to be shorter telomeres will be cofactors, including Alzheimer's and Parkinson's, chronic renal disease, disability in the elderly, cataracts, periodontitis, atopic dermatitis, psoriasis, telomere mutations. The link between many of these cofactors is going to be excess inflammation or oxidative stress, including oxidized LDL cholesterol, elevated homocysteine. The chronic viral infections are turning out to be major cofactors as well. If someone is CMV positive, they have 5 to 10 years of accelerated telomere shortening compared to those that are CMV negative. HIV, hepatitis C, Hep B, HIV, Epstein-Barr, human herpes 6, ovarian insufficiency, miscarriage, premature rupture of membranes, mitochondrial dysfunction. Response to medications, very interesting. If people who are depressed and are found to have low telomerase, and they, on the basis of the antidepressant, increase their telomerase, that increase in the blood can predict response to the antidepressant. Interferon alpha leads to lower telomerase, and therefore in the longer run, shorter telomeres. The NSAIDs, including aspirin, will decrease telomerase. How many of our patients, or even us, are taking these things every day? Cancer chemotherapy will shorten them. Risk of rhinovirus infection and symptoms. Actually was an interventional study where the researchers placed rhinovirus in the nares of patients, or they put control fluid without any rhinovirus. They isolated these folks for 5 days. Shorter telomeres was associated with greater risk of developing antibodies to rhinovirus and greater risk of having cold symptoms. Those with longer telomeres were much less likely to develop cold symptoms and were much less likely to develop antibodies. We've talked about the premature aging syndromes, idiopathic pulmonary fibrosis, aplastic anemia, graft versus host disease, because it's going to relate to the telomere length of the graft. Dolly died younger because of shorter telomeres in the nucleus that she received. So what's associated with longer telomere length? So one is going to be fish oil, the omega-3 fatty acids. This was the Heart and Soul study again from UCSF in following patients prospectively. Those that had the highest quartile level of fish oil had the least amount of telomere shortening compared to those that were in the lowest quartile that had the greatest amount of telomere shortening when followed over time. I think I'm going to skip that one. Longer telomeres are associated with hormone therapy. We'll come to this in just a moment. This is a study of 130 postmenopausal women, and those who had been on hormone replacement therapy, here was an average duration of 8.4 years, had longer telomeres than those who had not taken replacement therapy. Quote, telomere lengths were longer in postmenopausal women who had a history of long-term HRT than in postmenopausal women without. Long-term HT in postmenopausal women may alleviate telomere attrition. So our longer telomere list, longer quality of life, improved health span, which is quality of life, younger age, female gender, except, again, the Amish, increasing paternal age at birth, we went over that. Certain populations from certain geographic areas have been found to have longer telomeres. Here's the Costa Rican Nicoya area. Increased physical activity, increased education, smaller waist circumference in women, normal weight, Mediterranean diet. These are not surprising to many of us, I think. Dietary fiber intake in women. Talked about fish oil. Lower polyunsaturated fatty acids in women. Calorie restriction in a mouse model. Daily multivitamin in women. Vitamin D increases telomerase. There's a clear association between better vitamin D levels and longer telomeres. Vitamin E, including the tocopherols and the tocotrienols. Vitamin C. N-acetylcysteine, which is the precursor to glutathione, which is the master antioxidant molecule. Resveratrol is a mixed study. We can talk about that during Q&A. Statin therapy, interestingly enough, in several studies, increases telomerase, and the patients are more likely to have longer telomeres than control groups. Chemotherapy for Hep B increases telomerase. HDL cholesterol. There are some outliers here. Endometriosis. In women, they're more likely to have longer telomeres in their endometrium and in their leukocytes in blood. There's a whole talk tomorrow about autoimmune disease, so I'm going to skip over that. A major concept is many of the hormones are associated with longer telomeres, including IGF-1, surrogate for growth hormone, estrogen in women, testosterone in men, erythropoietin, and even aldosterone. The Dr. Dean Ornish program was just published that a small study, 10 men who did the Dean Ornish program completely for 5 years was associated with a 10% lengthening in telomeres, which is 2% per year. It's pretty good, actually. We have some patients who've had greater lengthening. But that's the first study just shown this year to be associated with a lifestyle factor or factors that can actually lengthen the telomeres. All these other studies I'm talking now about longer telomeres are prevalence studies or prospective studies. That's an interventional study that showed that very low-fat diet, plant-based, along with regular exercise, stress management, and a weekly support group was associated with longer telomeres. So-called Kirtan Kriya yogic meditation, 12 minutes a day for 8 weeks, increases telomerase. Mindfulness intervention for weight loss, daily meditation, and as we'll talk about here, TA-65 telomerase activation supplement has been shown to decrease percent short telomeres, amongst other things. So the new complement on Match.com, you can read it. So the mouse studies. Here, we're going to switch gears. I don't condone animal research. Others do it, and nonetheless, it's quite interesting. What happens when you block telomerase completely in mice so they don't get any telomere lengthening in their stem cells or germ cells? They age faster, dramatically faster. On the bottom is a control mouse, age 21 months. This is a telomerase null mouse, age 18 months, and you can see the mouse looks much older and the telomeres were much shorter. This was published, Longevity Stress Response and Cancer in Aging Telomerase Deficient Mice. So they get premature gray and hair thinning, delayed wound healing, decreased subcutaneous fat, reduced spleen size, decreased marrow cell production, intestinal villus atrophy, increased cancers, increased chromosomal abnormalities, and the males are infertile and they don't live as long. All these were statistically significant. the same telomerase null mouse model, when they mate with one another and you follow them over successive generations, G1 generation, G2, and G3, their median lifespan decreases and their maximum lifespan decreases. So is it possible that telomerase activation could delay or reverse aging pathologies? And the answer is yes. This is an animal model again. This is Dr. Maria Blasco, head of the Life Length Labs, and a lot of research in relation to telomeres. Mice overexpressing telomerase age more slowly than normal mice. This is the article. Telomerase reverse transcriptase delays aging in cancer-resistant mice, published in the journal Cell. So they increase survival at 3 years, 3% up to 42%, improve glucose tolerance, and increase subcutaneous fat, which tends, of course, to be lost with aging. So this is the wild type at age 2. This is the telomerase excess, if you will, and you can see the mouse looks much younger, coat is thicker, and much less gray. In the same study, there were longer telomeres in the hair bulge stem cell compartment. You can see with increasing, and there was decreased % short telomeres in the hair bulge stem cell compartment. So telomerase and telomere length is a significant cofactor for graying hair. In a tightrope manipulation, you know, mice, they have trouble walking when they get to be 2 years old, just like older people have trouble walking. More arthritis, have to use a walker, and so forth. And this also improved here compared to the control mice. In a different animal model, this was a telomerase knockout mouse, but then they reactivated telomerase and they wanted to see what would happen. So this is adult mice without telomerase, reactivated telomerase just for 1 month only, and then they were reassessed a month later. Telomere length increased, atrophic testes grew back, male mice became fertile, spleen, liver, and intestines reverted from an atrophic state, reverse brain aging. I'm going to show you that picture in just a moment. Sense of smell returned, there were no cancers, and they lived longer. The lead author, Dr. Rhonda Pinho, then at Dana-Farber, said, quote, "It was a near Ponce de Leon effect," and this was published in the journal Nature. Telomerase reactivation reverses tissue degeneration in aged telomerase deficient mice. This is the brains. You can see clearly that the brain here is bigger. Where's my pointer when I need it? This is the graph that shows the brain weight. And this is showing that the demyelination is reversed. So here is a myelin that is much less wide here, and with reactivation it reverts to a more normal state. So there is a supplement that can activate telomerase. It's called TA-65. It's derived from astragalus, which is a Chinese herb, been used for 2,000 years for qi and for liver health. And one particular molecule from the root, a small molecule telomerase activator, first discovered by Geron, then licensed to TA Sciences, will increase telomerase. There were safety studies. This is rat, immune deficient mice, no increased cancers, Ames mutagenesis test in lab, no carcinogenesis. So in a mouse model, when TA-65 was added to the chow, what happened? TA-65 decreased the % short telomeres, improved glucose uptake, significantly increased subcutaneous fat content, increased wound healing, significantly accelerated hair regrowth, and bone density improved in the 2-year-old mice. They actually did DEXA scans on these little mice. This was a dose that was similar to the dose that was used in some of the human studies, actually. It's listed in the article, which I have here, which is the telomerase activator TA-65 elongates short telomeres and increases health span of adult old mice without increasing cancer incidence, published in Aging Cell. This was the hair regrowth, so they were given TA-65 for 4 months, 12 months later, they plucked the hair off of the TA-65 mouse and a control mouse. 2 weeks later, complete regrowth and only partial regrowth. So in vitro in humans, TA-65 will increase telomerase. Here at the maximum concentration, about a 3-fold increase. Skin keratinocytes as well as human skin fibroblasts, increased concentration. You can see on this gel electrophoresis, increasing staining with increasing concentration. And these are the levels of concentration that are achieved in humans. So the initial study published in 2011, a natural product telomerase activator as part of a health maintenance program in rejuvenation research, observational data, an interim report of 37 patients, small number, but nonetheless worthwhile information. These are all the things that were being measured. The results after 1 year in a number that was 13 patients where the short telomeres were measured, significant decline in the percent of short telomeres in 10 of 13, significant decline in the percent of senescent cytotoxic cells. So the senescent cytotoxics increase as we get older. The immune system is not infinite, and every time a cell has to deal with an infection, it increased risk of becoming senescent. So that population increases as we get older, and the TA-65 was able to reverse that on the order of 5 to 20 years in that biomarker. It was mostly amongst patients who were CMV positive. Naives didn't change, although I can tell you in our patients we have seen naives that have increased, and non-significant decline in mean telomere length, although 39% did show an increase. Again, this is only 6 and 12-month data. We have a number of patients where the telomeres have lengthened from the TA-65. Safety in that initial report, no new cases of cancer or cardiovascular disease amongst the 260 person years of observation through June of 2010. No significant adverse events. 2 patients had some anxiety at a higher dose than recommended that resolved after dose reduction. We don't see any side effects, basically. This is the decrease in the percent short telomeres shown on the bottom. And in that article, they indicate, quote, the decrease in percent short telomeres we found makes upregulation of telomerase by TA-65 the most likely mechanism for this salutary effect. Telomerase preferentially lengthens the short telomeres. We conclude that the protocol lengthens critically short telomeres and remodels the relative proportions of circulating leukocytes of immunocompromised subjects toward the more youthful profile of non-compromised subjects. So an update of this was just published in Rejuvenation Research this last month, and they're now up to 7,000 person years of use where there's no adverse events or effects reported. In 59 patients evaluated after 12 months, significant decreases in glucose, insulin, total cholesterol decreased by 13, LDL cholesterol by 12, systolic blood pressure by 17, diastolic by 4, homocysteine by 3.6, and bone density improved by 2%. No drugs here. No drugs. This is just TA-65 in the vitamin pack. Hold the question. I'm running a little bit short. I promise I'll answer all the questions. This PowerPoint has the recommended dosing based upon age and so forth. I strongly recommend telomere testing because I just have seen some outlier patients where you really have to know what you're dealing with. And this is the recommendations from the company in terms of escalation of the dose and a drug holiday, 2 weeks every 3 months. So TA-65 increases telomerase. That can extend the telomeres. One word about cancer. 85% of cancers will have markedly elevated telomerase, but this is going to be due to mutations in TERT and TERK that will cause increased telomerase production. You have to remember, cancer is a failure of the immune system because the immune system cells, telomerase, are too short. And there are many, many other articles published to indicate why telomerase does not cause cancer. So looking at the case studies here, most of our patients taking TA-65 with follow-up telomere testing had already been in a full program of age management medicine for several years and were doing well clinically with minimal to no symptoms and do have regular cancer screenings. So you always have to ask the question, how many more test answers need to be correct for you to go from an A+ to an A++? People say, oh, you're taking the TA-65. What do you notice? How do you feel? They were already doing pretty well, but I can tell you that there still were anecdotal improvements. So we prescribed TA-65 to improve shorter telomere length, to improve percent short telomeres, improve lymphocyte subset aging, and to decelerate biologic aging, and to treat conditions associated with telomeric aging. We do have anecdotal reports amongst patients. They spontaneously tell me their energy is better, physical endurance is better, vision can be improved. We have 2 patients that their eyeglass and contact lens prescriptions need to be reduced, made weaker because of the TA-65. There's no other changes. Skin appearance can improve, arthritis can improve, sleep, less gray hair, although this is a minority of patients who report that, darker eyebrows, again a minority of patients, and fewer age spots. So our first case, 55-year-old businessman presented with typical symptoms of age management medicine, depression, anxiety, libido decline, erectile dysfunction, insomnia, and hair loss. You can see his past medical history. He was on various psychotropic medications plus full-dose finasteride. We diagnosed andropause, which is testosterone decline with symptoms, adrenopause, which is decline in DHEA, mood disorder. He had an elevated homocysteine, and he had a full spectrum of bioidentical hormone replacement, vitamins, minerals, nutraceuticals, lifestyle, including exercise, and he's been improved, although still has some intermittent anxiety, and there you can see his regimen there. So that was 2009. We did a telomere test 2011, so he's now 57. This was the SpectraCell test. Here you can see the mean, and he came out at 5.39 kilobases, which is the 12th percentile. Uh-oh. He was not happy about that because he was doing quite well on his lifestyle and in terms of his hormone replacement therapy. This is a perfect moment, folks, because there's nothing like an abnormal test or an abnormal imaging study to get your patient's attention. And this may be just the thing, if they're ready, they're pre-contemplative in terms of making lifestyle changes, of starting the exercise, of taking their multivitamins, stress management, stop smoking, lose weight, etc., etc., etc. So we did further tests. He was CMV negative. He was EBV positive for past infection, probably a cofactor here. We started TA-65, 1 capsule a day after 8 days, increased to 2 daily. So he wanted to know how he was doing. He didn't want to wait a full year, which is generally what we do. 10 months later, we did a repeat SpectraCell. So he went from 5.39, 2011, to 5.62 with no other changes. Again, he was already doing a full spectrum of age management medicine, and there's nothing different that he was doing. So this is an increase in 0.23 kilobases in 10 months, which is an age reversal of 4.6 years in telomere length. Remember at the beginning I said the average person loses 0.05 kilobases on average per year. And in 10 months, he gained 0.23 with an increase of 4.6 years. So he continues to take his TA-65. He's now due for another test. So this is pretty simplistic. You measure it, you get a test, you see something that's not optimal, you make an intervention, and you can see improvements. I'm running a little bit over. We'll do another case. 51-year-old woman, active family in her business, came in with perimenopausal symptoms, libido decline, memory, hair graying, past history of goiter, 30-pack-year history, diagnosed perimenopause, female androgen insufficiency, goiter. She had a lot of high toxic elements, 33 IgG positive food sensitivities, complete spectrum of bioidentical hormone replacement, vitamins, minerals, nutraceuticals, food elimination diet, lifestyle changes. Her naturopath added in some chelation. She was doing and has been doing much, much better, and her eczema is now only minor. So this was 2009. 2011, she's now 53, we get a mean telomere length of 6.45 with a percentile that's 37% percentile. Not bad, could be better. Nonetheless, we started TA-65 because we wanted to improve this. Dose escalation to 2 capsules daily. So that was September of 2011. 1 year later, September of 2012, she went from 6.45 to 6.93. That's an increase of 0.48 kilobases in 12 months, and it's an age reversal of 9.6 years when you do the arithmetic. Now, they saw that in the rejuvenation research study that was published. And she commented spontaneously, you know, I have less gray coming in. She told me that. So we continue the TA-65. Now, 8 months after taking the TA-65, or 4 months before this second SpectraCell test, we did the life length test. So you can't compare life length to the SpectraCell because life length is median, remember, and SpectraCell is mean. Nonetheless, median length 6.66, 60th percentile. Pretty good. How much of this was TA-65 versus not? Hard to say. Percent short telomeres, 18%, 35th percentile. Not bad. They give an estimated biologic age on the basis of this, and that was 40 years. She was 54 at the time. She was pretty happy to see that. So that was May of 2012. 17 months later, we did a repeat life length telomere. She went from 6.67 to 7.3. That's an additional increase of 0.63 kilobases during 17 months, or 0.45 per year. Additional age reversal of 12.6 years, or approximately 9 years per 12 months. And she continues her TA-65. Interestingly enough, her percent short telomeres decreased, 18% down to 14%. So she continues to take. And I think I've gone over. And so another, how to keep your telomeres long. You have handouts that has all these PowerPoints information. TA-65 clearly will lengthen short telomeres. Gone through various of the aging syndromes, the mouse models. TA-65 lengthened telomeres there, improved phenotypic aging. We went over the human studies. So final questions. Would AOS want Tithonus to have a telomere test? Yes. Would AOS want Tithonus to take TA-65? Probably, yes. Who should have telomere testing? I think everybody should, as well as all these other tests that are associated with age management medicine. Who should have bioidentical hormone replacement therapy? Again, testing and when indicated. Who should take TA-65 when indicated? So that concludes our presentation. We have representatives outside in the hallway who can answer more questions. The booths, I understand, will be starting later this afternoon. I also understand there will be a new TA-65 skin cream coming out next year. And there are also presentations tomorrow about telomeres and telomerase. There will be also some case studies. And I will be around to answer any questions. Thank you very much for your attention.